My name is Nicole. I'm a licensed clinician, and I'm here talking about everyday things that impact our mental health and fitness. We started off by jumping into the deep end and talking about post-traumatic stress disorder as well as post-traumatic growth. And before we move on to the next topic of discussion, I just want to kind of summarize and wrap things up and give some recommendations. So the first thing is that oftentimes people with post-traumatic stress disorder refer to themselves as broken. It's a normal response to an abnormal situation. Now, a lot of people have experienced various traumas throughout their life. Somehow it seems like if you've experienced one trauma, more traumas just kind of follow for whatever reason. I do want to take a look, though, at the actual diagnostic manual at post-traumatic stress disorder diagnostic criteria. The very, very first thing on there is the situation: exposure to actual or threatened death, serious injury, or sexual violence in one or more of the following ways. And then it lists a couple of different scenarios that you could be exposed to these things. It is the event that is the broken thing. It is not your response to it. If you have PTSD, if you have suspicions that you have PTSD, if you have some symptoms and not all of them, you're still not broken. The thing that I absolutely love about treating PTSD is that it is, I'm gonna just spitball on a percentage, I don't know. It feels like it's about 90% recoverable, which makes me take issue with the ratings for disability for the military regarding PTSD, but that might be another video. Anyway, and then the next criterion are about how you're responding to it, like what's going on, how many symptoms do you have, what's the severity of it. But all of those symptoms are normal responses. And also, post-traumatic growth can be a normal response. It doesn't necessarily mean that everybody who has a trauma develops post-traumatic stress disorder and has all these criteria. But it does mean that if you are one of those people who respond in this way, you're not somehow like unique or damaged or anything like that. It's the same thing as like, hey, you and I can jump from a 10-foot landing, let's say, and I can break my ankle and you can walk away unscathed, right? It is not that I am less than or broken somehow. It's that you clearly can just do that thing and walk away. And for me, that type of impact is a little bit too much for my body. So it's a very similar thing. If you feel like you meet the criteria for post-traumatic stress disorder, or if you're wondering if you do meet criteria for post-traumatic stress disorder, please go and speak to a professional. I don't care if you're military, if you're a first responder, if you're just a regular citizen out in the world doing your thing, talk to somebody. I talked already about cognitive processing therapy as being a really good approach. EMDR is also a really good approach, and I can talk about that in another video at some point as well. Man, there's a bunch of different approaches. You just have to find the one that kind of works for you, because not everything works for everybody. And the same thing goes with therapists. Like, chances are you're probably not one of the very, very, very few in this world who was able to marry their very first crush or high school sweetheart or their first love. And the same thing goes for a therapist. That relationship is very intimate, very emotionally intimate. And so doesn't necessarily mean that the first therapist that you meet is going to be the therapist that you stick with forever. You might not be comfortable sharing certain things with them. And so I would say give it 3 sessions, and then if you need to kind of shop around a little bit, by all means, like, go to somebody else. But I also would encourage you that if you're finding that no therapist works with you, and you've been through 3, 4, 5 therapists and nobody does this and that and the other thing, I would really start looking at what you're bringing to the table in therapy and what your expectations are. So all of that being said, I'm going to leave you with that recap of PTSD.